Hi, my name is Mara Clausen, and I'm going to do my informative speech today on Guttate psoriasis. I chose this topic because I personally do have Guttate psoriasis, and whenever I was diagnosed with it about 3 years ago, and ever since then, everyone that I talk to about it, just in the general public, or even different physicians or people in the medical field, not really a lot of people knew about it or knew what it was or even ever heard of it. So it's something that I wanted to talk about to educate the general public and everything about. I wanted to start off with a brief overview about it, just so you know exactly what I'm talking about. Guttate psoriasis, it's a form of psoriasis that shows up on your body in small drop-like forms, like it's in small drop-like spots. And typically psoriasis is seen as bigger patches. So this is how it differentiates from regular psoriasis. It shows up in these small spots, just tiny little spots all over your body. It is an autoimmune disease. You can get it as a child or as an adult, but typically it's seen more with children. Commonly shows up 2 to 3 weeks after you have a streptococcal infection, strep infection, like strep throat. And that's actually exactly how it happened with me. I had a strep infection, and then about 2 to 3 weeks later, I started developing these small spots on the trunk of my body. And then it spread from the trunk of my body to my arms and my legs, and then on my scalp. And I went to see my general physician about it first, and they kind of blew it off a little bit and sent me on my way, because at the time it was only on the trunk of my body when I saw him. So then after it spread everywhere, I got a referral to go see a dermatologist, and I finally got it formally diagnosed. So that's exactly what happened with me, and it does commonly happen like that. It shows up 2 to 3 weeks after you have a strep infection. And other viral infections can bring it on though, like chickenpox, rubella, or HPV. And although Guttate psoriasis usually occurs on the trunk of your body and starts there, like I said with me, that's how it started. It spreads to your arms, legs, it can develop on your face, your scalp, and typically the only place that it doesn't really develop at all is the palms of your hands and the soles of your feet. A couple statistics about Guttate psoriasis. Approximately 7.5 million people have the typical form of psoriasis, but only about 10% of that number have Guttate psoriasis. And like I said, just most people that I've talked to have never even heard of it. I never even heard of it before I was diagnosed. As many as 80% of the people diagnosed with Guttate psoriasis had a streptococcal infection first. And like I said, that was the case with me also. So there is a direct link between streptococcal infections and Guttate psoriasis. But based upon the research that I found and read, they can't exactly state what that link is exactly. But they know just from so many cases of seeing it that there is some kind of link there between the two. The clinical presentation of it, the symptoms that you would show would be, it's characterized with the onset of small 1 to 10 millimeter spots, little spots, and they're salmon pink to red in color. And if you look very closely, they may even have fine scales to them. Guttate psoriasis, it affects all races. And it affects men and women equally. Like I said, it does show up with children more so than adults, but it does occur with adults. I didn't get it until I was in my late 20s, so that's the case with me also. Diagnosis, a careful history should be taken of what drugs the person is taking, because sometimes 2 different drugs actually are known to be able to bring on onset of it, which is beta blockers and lithium. A family history should be taken because there is a genetic link with it. My mother actually does have the regular form of psoriasis, so that's the case with me also. A throat culture should be taken because, again, it is linked with the streptococcal infection, so they may want to do a throat culture to make sure that there isn't any streptococcal infection still lingering there. A skin biopsy, though, is actually the most useful diagnostic test to be able to diagnose guttate psoriasis. But typically, because the clinical appearance of it is so unique and it's so specific, typically dermatologists are able to diagnose it based upon appearance alone. But if they need to, a skin biopsy will for sure seal the deal. With treatments, there is medication that you can take. There are topical corticosteroids that they can prescribe you with. And there's either high strength ones or low strength ones. That was actually what I started off on. I started taking the topical steroids, and it worked a little bit for me, but it wasn't, I needed a little bit more than that, so I ended up doing more different treatments that I'll get into. But the mechanisms believed to provide benefit with the topical corticosteroids include anti-inflammatory, anti-proliferative, immunosuppressive, and vasoconstrictive effects. And because of the clear association with streptococcal infection, they may put you on an antibiotic therapy based upon if you still have the strep infection inside you on active or not. There's also a different type of therapy that is often used, and this is actually what worked for me in the long run. It's called phototherapy. And phototherapy is the use of light to treat various different conditions, such as different skin conditions, or it's also used to treat depression and others. This light, it occurs naturally as a component of sunlight, and it's called ultraviolet light that they use. And with ultraviolet phototherapy, it slows the abnormal growth of normal skin cells, which is associated with psoriasis. So it slows the growth of those skin cells and keeps it from getting worse, but it also clears it up like altogether, and that's what worked for me. I went to phototherapy 3 times a week for almost a year. It took me almost a year to clear up, and eventually it did do the trick for me. Recent studies have shown that there's virtually no instance of this type of therapy causing skin cancer, and in general, it has been proven for long-term use and for treatment of children with little to no side effects. So personally, I didn't have any side effects from it. I will speak very highly of it. It definitely worked for me as far as therapy. But in my conclusion, no matter what, love the skin you're in, and we all, I mean, there's so many different skin conditions out there, and you may never hear of them, but, you know, you never know what can happen to you, which is like the case with me. This came out of nowhere, and for a while, it kind of affected my self-esteem because I had these, you know, red spots all over me. But in the long run, I learned to love the skin I'm in and just educate other people about it. Thank you.